FX medicine is evolving. The same evidence-based research, ideas and thought-provoking conversations that you love in refreshed new formats. To help co-create it with us and for member rewards, sign up at fxmedicine.com.au. For now, enjoy this podcast previously recorded with Andrew Whitfield Cook. This podcast is intended as healthcare practitioner education only and is not a substitute for medical advice, diagnosis, or treatment.
This is FX Medicine. I'm Andrew Whitfield Cook. Joining us on the line today is Maria Shaflender from True Foods Nutrition. She's a fully qualified nutritionist who's trained in all modes of functional medicine testing, including gastrointestinal testing and analysis and microbiome management, plus thyroid, hormonal and toxicity testing and treatment. Maria has extensive clinical experience addressing complicated cases of IBS and other gut-related disorders, especially because of a passion which began with her own journey with irritable bowel syndrome. And I warmly welcome you, Maria, to FX Medicine. How are you?
I'm great. Thank you. Thanks, Andrew, for having me.
Now, amongst your other passions, thyroid and hormone analysis, things like that, treatment, today we'll be discussing IBS because you do have a personal passion for this condition, don't you?
Absolutely. Yeah. I've had gut problems for most of my life, pretty much since birth. And it's been a bit of a journey finding out what works and what doesn't and how to treat it. And that's actually what led me to study nutrition.
Now, you say that you were diagnosed in your early teens, is that correct?
Correct, yeah, high school, during the high school exam period.
Okay, so is one of the problems with especially irritable bowel syndrome because that we see this sort of perfect storm that, of the high stress, hormones are raging, there's high school, there's all of these issues, and then bang, you get a gut issue. So the diagnosis is made there. But as you said, you've had issues all your life, yeah?
Yeah. Look, I think there's definitely a genetic predisposition, and we know from research that the microbiome that we inherit from the mother during the birth is, predisposing to how our gut is going to function. So I think it started from not inheriting a fantastic microbiome. It had a lot to be desired from my mum's health at the time. And also, things that happen, which we see in clinic all the time, respiratory infections that kids get through because of nutrient deficiencies and, low vitamin D, things like that. All sorts of infections that require antibiotic treatments, ear infections, otitis media is another common one, which is usually, food intolerances trigger that, and then they end up on rounds and rounds of antibiotics. So I think when I was trying to work it out, I had about 40 rounds of antibiotics by the time I was 10 years old.
Wow.
Conservatively speaking, yeah. So that definitely was not a great predisposing factor for gut health. And then I actually moved to Australia from Russia when I was 13. And, the foods that were available here were really different and, very exciting, all these boxed cereals and all these, exciting packaged cardboard foods. So, which I embraced very excitedly. So I was pretty much eating, soy milk and light skim milk and cereal in boxes and lots of pasta and very processed carbohydrate foods and sugars that were completely the wrong thing to be doing for one's gut health.
Can I just take a step back a bit? Do you know if there's any research looking at multiples of courses of antibiotics, so not just 3 and 4, but 10 or whatever, with worsening risk of irritable bowel syndrome?
I haven't seen any specific papers on that, but the research that I've looked at to do with antibiotics is telling us that from one round, it usually takes 12 to 24 months of recovery for the gut, to come back to its original condition. So I think, if someone is exposed to multiple courses over a period of time, especially without taking anything or doing anything to actively repair and replenish, I think that creates a really negative environment that predisposes.
There's a lot of variance in that recovery period. I've read papers saying as short as like 3 months, and as long as like 24 months. But I guess one of the issues there is, well, you get the answer to what you've measured.
Yeah. And look, I think it's a lot of the time people don't actually do anything to actively recover. That's the other issue.
Right.
They might get a random probiotic from their health food store and take it for a couple of months, and that's it, if that. So it's that the lack of active recovery, and then just a perpetuating diet of highly processed foods, which is then feeding the negative bugs that have taken residence. So it becomes a really perpetuating cycle.
Sure. But you say that, I'm imagining your symptoms would have worsened and culminated in the diagnosis during your early teens, but you can remember episodes of pain and gut problems in your childhood?
Yeah, absolutely. Probably not pain. I don't remember ever being in pain, but definitely just not digesting things,
right.
And, having like weird toileting habits that, children don't really normally pay attention to.
No.
But, just having trouble digesting things, and also having different reactions from one day to the next to the same meals, which is really characteristic of IBS, where people can be eating the similar sort of stuff from day to day, but getting different reactions. So it's that, really dysregulated system. And I think there's, a lot of evidence from studies that shows us that higher cortisol levels in childhood can really predispose to disrupted gut-brain communication.
Right.
So, things like moving countries or any sort of, traumatic events, emotional events that happen to us in childhood, will really put someone in a state of predisposition to IBS.
And do you think it's one of those conditions that you have a perfect storm happening? Like it's, the food, then the changes in the food, the packaged food you were talking about, and then you add on a stressor, so the move from country, and then you add on the change in stress that you feel from changing body image, say, for instance, entering your teenage years and the pressures of school, and then bang. It's sort
absolutely.
Of right.
Yeah, absolutely. I think the amount of pressure that kids even these days, a lot more than when I was at school, have in terms of performance and getting academic results, and getting this one mark at the end of high school, which is supposed to determine your entire destiny.
Yeah.
There's so much pressure, and I can see that with my own kids, who one of them has just started high school, that it's really a lot to cope with. And, these days there's also social media and all sorts of body image pressures as well. So, looking after our stress management becomes really critical at a very early age.
So let's talk about irritable bowel syndrome as a diagnosis. What's the pathology? What's the current thoughts on the pathology of IBS?
Well, the IBS seems to just fall into this sort of catch-all bucket of when everything else has been excluded. So it seems to be through, the medical system, people go through and get their colonoscopy done, and sometimes their endoscopy as well. They get their basic, stool tests, and essentially, unless, you have something wrong on your colonoscopy, or they identify a parasite, which they prescribe antibiotics for, if there's nothing obvious found during that time, and things like Crohn's disease or ulcerative colitis have been ruled out, it becomes you have irritable bowel syndrome. So syndrome, as we know, not a disease, but a collection of symptoms. So then that puts the person into this sort of no man's land of trying different things. Often they get prescribed the FODMAP diet, where They cut out a lot of different foods that some of them are triggering of the symptoms. And essentially, they just get told to watch their stress levels. So that's the most common story that I see.
I love that
clinic.
one. Watch your stress levels. Don't do anything about it, just watch them.
Yeah, there's a lot of sort of let's wait and see and monitor. Those seem to be the words that are used a lot. Yeah, so it kind of takes any sort of proactive action away from the person. Yeah.
It seems to be rather placating, doesn't it, rather than an active treatment?
Absolutely, yeah. It's very rare that I've had someone come in clinic where they've actually been recommended to see a psychologist or do any sort of mindfulness work or even, start yoga, breath work, like any of those really simple things that people can do often is not on the list of recommended things. And a lot of the time it's, download your FODMAP app and off you go. Yeah.
Okay, so what about, the use of even medications here, like, maybe loperamide to help with the diarrhea or mebevidine, Colifac? Why isn't there even offering of these medications?
Yeah, I think, so the constipation type of IBS, they usually will get prescribed laxatives.
Yeah, Motilium,
Which, from long-term use of laxatives, we get a whole bunch of different bowel issues as well. So it's not really a long-term solution. It might help someone in the short term, but it doesn't address the root cause. And I think with diarrhea, just from my experience, there's always some sort of underlying pathogen that is missed, that keeps triggering the diarrhea, or some really major food intolerances, usually to dairy, which, sends people straight to the toilet a lot of the time.
Gotcha.
So, yeah, there seems to be some really obvious causes and triggers that are often masked by the medication.
Okay, and do you find these people are diagnosed using just rough symptomatology, or do you find that healthcare professionals are getting on board with things like the Rome criteria and they're really delving into functional GI disorders?
Yeah, absolutely. So, if they end up going through to a gastroenterologist, there's a lot more of the work that's done. Usually celiac disease will be ruled out. They might be taking samples from the colon or the small intestine to look at something else. And yeah, there's definitely, people do get that workup. But I find a lot of the time they're not really progressed through to the gastroenterologist unless there's some really, really serious symptoms. So, unless they're having explosive diarrhea or something that the medical professional might get really concerned about. But most people I find fall into that sort of group of mild, annoying symptoms that disrupt their day-to-day life and create a lot of anxiety and often depression that are not really taken that seriously.
Do you think there's a real risk of IBS being trivialised in that your people, and this is all people, including health professionals, seem to sort of treat it as it's a little bit of an upset tummy and it's an embarrassing condition, whereas I've known of people who have been hospitalised with IBS.
Yeah, absolutely. Yeah. So I guess that's why it's such a frustrating diagnosis where, the severity can be really varied. And, people do end up with bouts of, especially if they've had a major stress or something go on in their life, they will end up with a really severe flare-up and end up in hospital. And a lot of them are really frustrated by the lack of a proper diagnosis, just being told that, oh, yeah, IBS, there's no cure. A lot of the Facebook forums that I follow, that are public Facebook forums on IBS, just to understand what people are saying about their condition, it's very much about this is a lifetime thing that you need to manage. Yeah. So no one even talks about resolving it at all, as far as I can see. Yeah.
Right. Okay, so the appropriate sort of stepping stone is how do you get A, to the GP, get them to understand there's a real issue, and B, how do you then get specialist involvement for a diagnosis?
Right, exactly. And I think, unfortunately, you have to have something wrong on one of your tests to be able to progress through all those steps.
Oh, really?
So, Yeah, I find that often that's the case. So, unless you have polyps in your colon from your colonoscopy or ulceration in your small intestine or, something that's found to be a pathology, it's really tricky, to actually get proper attention. And that's where, nutritionists and naturopaths, I think, can really shine in terms of our more holistic understanding of gut conditions.
Yeah, I can see also there's a risk of being treated for that abnormality rather than the IBS. Like if you've got a solitary rectal ulcer, if you've got hemorrhoids, if you've got, forgive me, I can't remember the condition where you basically got to push me, pull you with the rectal muscles.
Right. Yeah.
Incomplete evacuation is what it leads to. That sort of issue, I can see that it really does require some expertise to go, what's going on here?
Yeah, and I think also people end up being selectively treated for certain pathogens, usually with more antibiotics, which then perpetuates their gut problems and perpetuates their IBS. So a lot of the time it's, with parasites, if a parasite is found on a stool test, usually someone will be prescribed antibiotics and then it doesn't resolve the problem. So even if the retest comes back with no parasite, the person is then often still experiencing the symptoms and just wondering, well, what happened? The parasite's dead and I'm still having all these problems. So as we know, it's a lot more about the terrain of the gut and the overall condition of the gut rather than a presence of a specific organism.
Right. And also perhaps failure of treatment.
Yes, exactly.
You mentioned, I know I'm sort of dancing around a bit here. I will sort of get back onto a train of thought, but you mentioned food sensitivities before. Mm-hmm. I'm thinking about testing here. How useful is testing for food sensitivities?
So I find, it's a tricky one. Lots of clients come in with having had food intolerance testing done, either ordered it themselves online or with a previous practitioner. And, they come with a list of 40 things that they are, quote unquote, intolerant to. And they then exclude all those foods from their diet. And usually that doesn't really resolve those symptoms either. So I think we have to make a really obvious distinction between food intolerance testing, looking at the immune activation. So, for example, testing your IgG antibodies or food allergies, testing your IgE antibodies. So that's really looking at the immune system and what's happened with those foods triggering a reaction. But as we know, a lot of the time, it's the condition of the gut which is allowing that to happen. So, with leaky gut or intestinal permeability, it's if the gut doesn't have a really well integrated protective layer and all those cells, tightly standing together in their little tight junctions, those proteins from food are going to be coming in and out, triggering all sorts of immune activation. Yeah. So, it's a lot more about the gut condition. And then I think people also get confused with sensitivities. So, foods that are high in FODMAPs with, their fermentable carbohydrates, they might trigger bloating and gas and discomfort. That's not because someone is intolerant to the food. That's because it's triggering a gut response from a bacteria in the intestine. So that's going to create symptoms, but that doesn't mean the person is intolerant to the food. It's just not getting digested properly.
Yes, I'll give you a big here. And I don't have issues with reasonable use of FODMAPs, of the FODMAP diet. My problem is that the FODMAP is called the low FODMAP diet, not the no FODMAP diet. And I have real issues when people exclude important food groups.
Yeah, and I find also frustratingly, it doesn't exclude the ones that really need to be excluded.
Yes,
so,
yes.
For example, with dairy, I find the frustrating part is, let's take the lactose out, but it's not just the lactose that's the problem, right? It's usually the protein, which is the casein, which is really inflammatory for a lot of people with gut issues. So, just taking out the lactose is not going to resolve the issue. Or, gluten, for example, just taking out the fructan from the wheat doesn't take away the inflammation and the toxicity that comes with gluten. So that's the frustrating part is, the foods that really should go are not taken out. And then the foods that can still be eaten in moderation and are really important prebiotic fiber foods like fruit and vegetables, with a humble apple, for example. The poor apple that's just been completely demonized, that's taken out, and the person is not getting the fibers and the prebiotics and the vitamins and the minerals from those foods. So that creates a whole bunch of other issues.
Yes, you remind me saliently of Mike Ash's stewed apple ramekins.
Yes.
The recipe of which is up on the FX Medicine website if anybody wants to go and look there for it. But I'll always remember his sentence. He said, "Low FODMAP, anyone?"
Yeah. Absolutely. And I actually, since that time that I heard Michael Ash talking at that symposium, just a few months ago, I did a phone interview with him for a program that I've been working on, an online program for IBS. And we talked at length about the cooked apples and, all the amazing constituents. And there's more than one, it's not just pectin, there's a whole bunch of different
raffinose
constituents. And all those fibers and prebiotics and gut healing substances. And I found it so amazing because cooked apples is something that my grandfather used to make for me when I was a kid. It's a very traditional Russian dessert.
Yeah.
Stewed apples with cinnamon. And
Bingo.
It's just one of those amazing foods,
Okay, so just going back to pharmaceutical medications again, there's a lot of options there. They do one job very well, sometimes too well, sometimes with ensuing side effects. I remember one of the Cetron groups of drugs, the 5-HT, I think it's 3 antagonist, was taken off the market because, in Australia at least, because of side effects. But what about the use of, you mentioned depression, so antidepressants, SSRIs?
Yeah, well, as we know, a lot of our serotonin is produced in the gut. And I think experts sort of have a debate about, is it 60%, is it 80%? A large percentage of serotonin is produced in the gut. So if someone is lacking abundant microbiota to be able to produce those neurotransmitters, sometimes, putting the serotonin back in can help us regulate that bidirectional flow between the gut and the brain. So, yes, it can help definitely if the person is actually deficient in serotonin.
Yeah.
So, a lot of the time when I do some biochemical profiling with mood disorders, I find that just based on people's symptoms, when you really look into it, it's not only serotonin that's a problem. A lot of the time with gut stuff, it's acetylcholine, which is, it's so important for the motility of the gut. So, just prescribing a drug to boost one particular neurotransmitter, sometimes it works. There will be a certain group of people that it will help, but I find the majority really doesn't.
Yeah, you've got various receptors in the gut. Like, is it 1, 3, 4, 7? And they have varying functions with propulsion. So if you just add a serotonin reuptake inhibitor, there you go. It's not really controlling how those receptors do their work. So I totally get your point about acetylcholine. So what, therefore, do you use then to support acetylcholine?
Well, look, with acetylcholine, the main issue is that the person will be put into sympathetic dominance.
Gotcha.
So it goes back to that whole stress connection, because acetylcholine is there to really power the parasympathetic nervous system.
Right.
And what it also does is helps us release our hydrochloric acid and enzymes and, help with the whole peristaltic action of the gut, the movement. So if we're deficient in acetylcholine, we're going to have problems right at the top of the digestive system with breaking down the proteins in the stomach. So I guess, one of the nutrients that really feeds into acetylcholine is acetylcarnitine, as well as our B vitamins and choline. And, most people do not get enough choline in their diet, maybe from eggs a little bit, but, most people's diet is really deficient in choline. And most people's mitochondria don't work too well to produce acetyl-L-carnitine. So it becomes a bit of a tricky thing, but I think that it's bidirectional again. So if someone's spending a lot of time in sympathetic dominance, if they're stressed, then they're going to be using up their B vitamins and magnesium and all the other things that require us to produce those neurotransmitters.
There's so many issues I see in the research, and one of the issues is the messenger is shot, basically. There's an issue with TMAO from choline, metabolism, but it's metabolism. Metabolism, it's the bacteria that's the issue. And yet it's choline that's blamed.
Yeah. And look, I also think that it's a catch-22 because when someone is stressed, it's going to put their stomach acid down. So, they're going to have a lower level of hydrochloric acid. So then absorbing all those nutrients from the food is going to become a problem. And then when they don't have the nutrients, they can't power up those neurotransmitters. So it becomes a bit of a vicious cycle.
Right. I wanted to get to this a little bit later, but I have to bring it in now. And do you favour the use of things like vagal nerve stimulation to help with the sympathetic nervous stimulation to settle it down?
Well, I haven't had any experience with devices. I know, a lot of practitioners use devices, particularly in chiropractic and osteo fields that actually will stimulate the vagus nerve. In our clinic, we use more breathing exercises and hypnotherapy. Yeah, hypnotherapy, mindfulness, stress reduction, breathing, all of those exercises to give someone the tool that they can just use at home, to start reprogramming their vagal tone.
Now, hypnotherapy was very interesting because it had a very high success rate.
Yeah. All the studies with hypnotherapy and irritable bowel have been really successful. So I know there's a study that showed hypnotherapy was on par with FODMAP in terms of resolving symptoms. My approach is, and that's what I've been working on with the program, to put both together. So I don't think it's either nutrition and diet or mind work. I think you have to really do both, and that's where people have the most success. So I don't think you can say, well, I'll just keep eating gluten and dairy and all these problem foods and I'll just do hypnotherapy and I'll be fine. I don't think it would work like that. So I think the combination of both is the most powerful tool.
And when you're dealing with the gut, I mean, there's a whole world opening up to you. It's like we've spoken about this before in podcasts. Do you really start with simple things like how do you chew your food? Do you try and relax before a meal? Do you eat in a stressful environment? Those sort of basic, simple things that Grandma told us about and we never did?
Absolutely, yeah. And it's really about slowing down and being mindful. So that's where, a lot of the mindfulness stuff comes in to really draw people's attention, and not only on what they're eating, but how they're eating. So exactly what you said, not chewing properly, not having your mouth open when you're eating, chewing for many, many times, being in a calm environment. So, people are eating when they drive and people are eating in front of their computer, and they're not going to be digesting their food when they're doing that, really. So, yeah, a lot of that stuff is really, really simple things that we've forgotten how to do.
Yeah. And what about things like starting high up with things like aperitifs, good old gentian maybe as a herb? Are there any particular things that you use that might help even stimulate stomach acid secretion?
Yeah, absolutely. So even, apple cider vinegar and lemon juice in water. Yeah, really, really simple stuff that's available cheaply to anyone. You just have to be careful. I find some people can't really tolerate apple cider because they've got so much gastric inflammation. It's literally just burning their insides.
Yeah.
But, unless it's really serious like that, most people can handle it. It's a really nice, digestive stimulant. I find even the apples do that as well. The cooked apples can be a really nice digestive stimulant. And, the other one is ginger, which is, really, I think, underused and undervalued, where, you can do grated ginger or just boil some ginger pieces in hot water, drink it as a tea. But, it's one of those warming digestive tonics, yeah.
Now we're on to the stomach. And, like the gut superhighway begins, basically. So what about digestive enzymes? Do you ever employ those? And what sort of facility do they have? What sort of promise do they hold?
Yeah, absolutely. I'm a massive fan of betaine and digestive enzymes, and usually a combination of both of those things, because with the stomach, and this is something that I've struggled with, in my life as well, it all starts with the stomach. So, if we're looking at the causes of IBS, which we haven't really touched yet on SIBO, anything which is the causal driver will usually originate in the stomach, where people are not digesting their food properly, and particularly, not breaking down the protein. So instead of getting individual amino acids going nicely through our intestine and getting absorbed, they're ending up with peptides with, multiple bits of protein that's not properly broken down. So I find that, enzymes, hydrochloric acid boosting supplements, all those things, anything that helps the stomach, zinc and B6 is another really, really important one. Everything that we can do to make the stomach work better is going to really help with IBS.
So SIBO, we're on to that.
Yes.
I remember Stephen Sandberg-Lewis opened my eyes and Narala Jacobi, but I still have questions with regards to SIBO. I note that it doesn't appear at all on Rome criteria. So where does it sit?
Yeah, sure. Yeah, look, it's a tricky one. So, I think amongst the complementary health practitioners, there's probably a bit of a division, I would say, with, the SIBO believers and the SIBO non-believers, and someone in between, in the grey area in between. So, look, I see SIBO as a symptom. It's definitely, it's a bit of a symptom and a cause. So when the stomach is not working properly, you're going to end up with a bacterial overgrowth in the small intestine.
Yeah.
So when the gallbladder is not working properly and you're not getting the bile to be the antimicrobial substance, you're going to end up with an overgrowth in the small intestine.
Yeah.
Right. So, is that the cause, or is the low hydrochloric acid actually the cause, that originates everything? And then you've got the movement issue, so the peristalsis that goes off, in SIBO. So, yeah, look, it's an interesting one. I don't think yet recognised by the medical mainstream. But what I find is, if people are having responses to carbohydrates, so if someone is getting gassy and bloated anytime they eat one of those FODMAP foods, pretty high chance they have some sort of bacterial overgrowth in there. And a lot of the time I find that just doing a bit of a trial with an antimicrobial substance, something simple like a bit of oregano oil, is really effective to see how they will respond and what's going on in there. So, if you trial that for a month with a practitioner and your symptoms significantly reduce, well, there's a pretty high chance there's a bacterial overgrowth in there that needs to be addressed.
We know that we can't get into the upper portions, into the middle portions of the small intestine. We can only get into the upper portions of the small and the highest reaches, if you like, of the colon. So there's a whole area of the digestive tract that is really out of the realms of assessment. I'm also very cautious about, if we're doing poo testing, you're looking at what's coming out, not what's in there. or what's staying in
Yeah, absolutely. Yeah. And look, this is, comes down to the clinician sort of using the tool that they use and getting really good at it. So, my belief is, choose a tool that is consistent for the clients and is consistent between the first test and your treatment and then the second test. So I actually do utilize stool testing.
Yep.
In clinic, and I do find it really useful. And a lot of the time, if there's an overgrowth of bacteria in the bowel, it's pretty common that it's going to go up into the small intestine as well. And I've had a huge number of clients come through with having done a SIBO test and being negative for SIBO. And then, we do the bowel test. They've got all this bacterial overgrowth in there. We treat that, and then their symptoms resolve.
Right.
So, I find that from my clinic experience, looking at the bowel is far more interesting than doing a breath test for SIBO. But that's just been my personal, clinic experience.
Gotcha. Okay. I was also reminded by a gastroenterologist about the concept of dysbiosis is, as he said, a concept. How do you treat a concept? But I guess the proof in the pudding for your patients is, A, their symptom resolution that is maintained, but B, if you can show a difference in tests over time. So a baseline and a test level. So is this what you find? You can show this?
Absolutely. Yeah,
wow.
yeah. So using DNA PCR stool testing, looking at, starting with your baseline and addressing whatever microbial imbalances are there, focusing on rebuilding the gut environment, so lots of pro and prebiotics as appropriate for the person, and then changing their lifestyle, changing their diet, doing all that work. I find usually for about 6 months, and then doing a retest, and 95% of the time there's a huge improvement both in the diversity and the count of the positive bacteria.
Yeah.
And as well as elimination of things like parasites or Helicobacter pylori or, anything else that comes in there.
You said prebiotics. Now, prebiotics can sometimes cause excessive wind. Indeed, one of the prebiotics, lactulose, is used to help the gut, but it's also used as a laxative. So when you've got an IBS-D dominant patient, how does that work? Do you just decrease the dose? Do you use it at all?
Yeah, I definitely do. I find with IBS-D, 95% of the time there's going to be some sort of organism that's triggering the diarrhea. Right. So usually, it will be a parasite or some sort of bacteria that's become extremely dysbiotic, as well as food issues. So it's incredible how many people with IBS-D are regularly having cow's milk and not putting the two and two together. So that's a really simple starting point where, we go through the diet with a very fine look and get rid of anything that can be driving the diarrhea. So a lot of the time just the dietary change is pretty significant. Then looking at any dysbiotic or pathogenic organism and targeting that first. And then I would be looking at adding a prebiotic and probably using the single ones. So, your guar gum, partially hydrolyzed guar gum seems to be a really nice non-reactive one, that's become quite popular. So starting really, really low with like a pinch, and just building it up slowly. Yeah.
Okay. Yeah. And you were talking about terrain earlier. So, betaine and what about other just micronutrients, for instance, zinc?
Yeah. Look, zinc is one of the things that I absolutely love in life. And I think if I had to be put on an island with the choice of one supplement to take with me, it would be zinc.
Oysters.
Yes, yes, it would be oysters and zinc in a bottle. I absolutely love zinc. Pretty much every one of my clients walks out with a bottle of zinc in some form or another. So, yes, it's amazing at, first of all, helping with our hydrochloric acid production. It's completely fundamental for that. It's fundamental to hold the tight junctions in the gut together. It's fundamental for our mood and serotonin production, and probably 100 other things that I can't think of right now.
Absolutely.
Immune system, right? Yeah.
What enzyme system isn't affected by zinc?
Exactly.
So hypnotherapy. Take us through a little bit of how hypnotherapy is approached with IBS.
Yeah, so in our clinic, so my partner, Scott Allerton, who's a clinical hypnotherapist, looks at a lot of my gut cases. And usually when someone comes in with IBS and gut issues, 99% of the time they'll also be experiencing either anxiety or depression or PTSD or some other mood-related issue. Usually those things perpetuate what we call a sympathetic state, so a fight-or-flight state where the person is stuck in that, stressy state where everything triggers them and their entire nervous system becomes hypersensitive. So, a lot of the time people will come in with they're sensitive to noise, they're sensitive to light, they're sensitive to music. They become hypersensitive. So just like their gut is hypersensitive to food, so visceral organ hypersensitivity, their nervous system becomes really, really sensitive. So, of course, they're going to be reactive to things. So what hypnotherapy does is it basically takes the logical thinking brain out of the equation for the duration of the treatment. So putting someone into a state of focused trance, so a very calm and relaxed state, the person's still totally awake, but they're calm and relaxed and their brain's not thinking. So there's all that critical thinking and evaluation goes out and they tap into their subconscious. And that's really where things come up. So, their stressors, their past trauma, and whatever is driving their stress usually comes up to the surface. And then it's the therapist's skill to talk them through it in a way that's very safe and emotionally cleansing,
Wow.
I guess. And yeah, it's a really powerful tool. And what most people will say is like, "Oh no, I'm too awake. I can't be hypnotized. I always have to be in control and all that sort of stuff." They're usually the people with the gut problems.
Yes.
So it's everything. Everyone can be hypnotized, and it's up to the skill of the professional, and also just allowing oneself to relax enough to be able to stop thinking for a little while.
Which is a challenge unto itself.
Yes.
So what about ongoing therapy? Does the hypnotherapist teach the IBS patient to take home some skills so that when they're encountering a stressful situation, they can sort of, regress is not the right word, but retreat into themselves?
Absolutely, yeah. So usually, after a few sessions, the person is calmed down enough and is parasympathetic enough, relaxed enough to be able to handle things better anyway. So their entire stress baseline is taken right down. And then, there's lots of techniques with breathing, visualizations, specific tools that can be used day to day to be able to manage our stress much better. There's always usually recordings that can be listened to as well. So, Scott does a lot of recordings and we put that into the program. So something that they can then just listen to before they go to sleep to really bring their day stress level down. So it's usually something that requires some input and ongoing management from the person, to be in control of their own stress response.
What about any other resources that we can learn from? What are some of the best that you've come across?
In terms of stress reduction?
Stress reduction, IBS, whatever you feel is great.
Yeah, look, there's lots and lots of literature out there in terms of the stress and IBS connection. So there's been really good studies that I've come across that talk about how the gut-brain axis operates, how we deal with stress, how all of those things impact. So there's lots of research out there. In terms of resources, I would say seeing a practitioner is probably, really important, because it's important to personalize your treatment.
Yeah.
Right. So testing, I think, is a really, really important part of that, where, you can really look into the gut and understand what's happened in your own unique microbiome. In terms of online, easy-to-use resources, I'm about to launch the IBS healing program.
Ah, great.
So
okay.
That's something, that's an online program that Scott and I have put together that covers a nutritional component with everything to do with how to get rid of the wrong foods, how to find out what the right foods are for you, how to use food as medicine and healing, as well as all those stress reduction techniques. So that will be available online very shortly.
Okay, so that's more of a patient resource, right?
Yes,
yeah,
absolutely.
Okay. All right.
Mm-hmm.
And for practice?
Yeah. For practitioners, there's quite a number of books on hypnosis and stress reduction. There's lots and lots of research into, everything ranging from Hans Selye, who's, one of the pioneers, looking at the stress response. There's also a lot of books on, just trying to think of the author, but everything that looks at, how our emotions affect the gut and how the stress response becomes dominant in the body and how difficult it is to turn it off. One book I can think of that's fantastic is Gabor Mate, and it's called When the Body Says No, the mind, the stress and body connection. So he's someone who's identified lots and lots of health conditions where stress has been a major driver, including gut-related conditions.
Brilliant. Well, I'll definitely put these up on the FX Medicine website for everybody to learn from. This is fantastic information, Maria. Thank you so much for taking us through this.
You're very welcome.
And your personal journey today, because I realise that when somebody suffers from something, it can be quite confronting when you admit that, if you like, to the world, but B, it can also empower you, because it's really sent you on a true journey of expertise to help other people. So I really thank you for discussing your story, but also where it's led you in helping others today.
Brilliant. Thanks so much, Andrew. Great talking about this topic.
This is FX Medicine. I'm Andrew Whitfield-Cook.
Thanks for listening. To make sure you never miss an episode, subscribe to us on YouTube, Apple Podcasts, Google Podcasts, or Spotify. You can also let us know what further topics you'd like us to cover by contacting us through our website, fxmedicine.com.au, or by connecting with us on Facebook or Instagram.